Welcome everyone from Psych 314A. My name is Lauren Messenger and this is my informational public service announcement on eating disorders. Today we will be discussing the causes, symptoms, and treatments of a few of the common eating disorders and where to find help for yourself or for someone that you feel may be affected. Per the American Psychiatric Association, an eating disorder is classified as severe and persistent disturbing behavior associated with distress and emotion. This can come in the form of someone constantly on an extremely restrictive diet, someone eating as much as possible in a sitting, someone throwing up on purpose, or someone eating foods that aren't classified as actual food. 5% of Americans are affected by eating disorders, and this number is likely skewed as many people with eating disorders prefer and attempt to keep them a secret for fear of judgment and scrutiny. While each eating disorder has their own list of causes and symptoms, contributors are generally a mix of biological, psychological, and social reasons. Predisposition genetics, low overall psychological health, and social stigma or personal experience with trauma and bullying can all lead to eating disorders. The first eating disorder we will discuss is anorexia nervosa. Anorexia nervosa is an obsessive disease in which the person suffering has a phobia of putting on weight, generally ending in body dysmorphic disease, where they believe they are overweight even at times when they are truly underweight. This causes an obsession with restricting food. People suffering from anorexia nervosa generally have a distorted body image, a fear of putting on weight or eating, engaging in highly restrictive diets, binging and purging, continuous exercise, and also the use and abuse of laxative and diuretic. Treatments for anorexia nervosa generally involve a mixture of therapies and medications. Therapy can help improve the self-image of the patient and work on the various mental factors of the disease. Medications can help with any of the depression or psychosis involved. Help can be found at findhelp.com. Binge eating disorder affects about 2% of people in the world and can lead to various other diseases such as high blood pressure, high cholesterol, diabetes, and overall poor health. It can be caused by genetics, trauma, or other psychological conditions. According to the DSM-5, symptoms of binge eating disorder are recurrent episodes of binging, meaning eating in a discrete period amount of time, eating larger portions than most people would, having a lack of control during the episode. All of these must be associated with at least 3 of the following: eating more rapidly than normal, eating until feeling uncomfortably full, eating when not actually feeling hungry, eating due to embarrassment, and a feel of disgust with oneself after the binge has completed. Treatment for binge eating disorder includes therapy to focus on self-image and improvement. It can also include medications to assist with other psychological conditions or health issues that have arisen due to the overeating. Pica is an eating disorder in that people ingest items that are not food. For example, someone may like to eat toilet paper, drywall, dirt, paint, cloth, or hair, etc. The cause of pica is currently unknown, but is seen mostly in children and can develop in adults, and is also seen in adults with developmental disorders. Treatment generally includes initial testing for nutrient deficiency and application of medical treatments for any other issues that may have been caused due to the person ingesting these items. Treatment also includes behavioral and psychological therapy. So what should you do when you think someone you know may have an eating disorder? Per the National Eating Disorder Association, the ways to assist look something like this. First, learn more about the specific disease that you think they may be experiencing. Second, plan out what you will say. Third, plan to talk in a private area. Fourth, be honest and caring. Fifth, prepare for negativity. These are very hard topics, and someone may not be ready to have that conversation quite yet. Encourage help, and last, reaffirm your support for them. Even if they don't decide to make a change that day, let them know that you care for them and are present to support them in any way they need. For any more information on this topic or how you can help someone or yourself, please visit thenationaleatingdisorders.org. Thank you so much.